Most people keep asking us, what is the cost of dental treatments in India? We have calls coming up from patients asking for what is the cost of a root canal treatment, what is the cost of laser treatment, flap surgery, implants. Today in this video, we will talk about various dental treatment costs in India. Hi, I am Dr. Sridhar Reddy, practicing dentist for the past 20 years at Happy Dental Hospital, Nellore. Cost of dental treatments in India. When we speak about the cost of dental treatments in India, first thing we have to see is there are two types of diseases which we most commonly treat in our dental office. First thing is dental cavity. Dental cavity, usually when you see a tooth has an outer protective enamel layer, inner dentin layer. Inside that, it has nerve supply. When the cavity of the tooth is in the outer enamel and just gone into the dentin layer, you can do the treatment by a filling, simple filling, removing the cavity and restoration by a filling. This filling usually costs between 500 to 2000 rupees. Then, second stage of the cavity. Once the cavity spreads into the nerve supply of the tooth, the treatment becomes little more extensive, like you need to do a root canal treatment, need to give a permanent filling, take x-rays. The cost of all this usually costs from 6,000, 7,000 rupees to 10, 15,000 rupees based on the crown you go for. Then in the third stage, once the tooth is badly gone, the cavity has eaten away almost all the tooth. At this stage what happens is you will have to remove the tooth, extract the tooth, go in for an implant or going for a bridge. Bridge or an implant usually costs somewhere between 9 to 10,000 to it may extend up to 40, 50,000 based on the implant you go for and the crown you go for on that, which in detail I will be explaining later. These are the treatment costs for dental cavity. Then you have the other disease which we most popularly treat in our dental office is gum disease. Gum disease, it will be usually plaque and calculus, just dust around the gums and teeth. We just do cleaning and polishing which may cost around 1000 to 2000 rupees. Suppose you delay this at this stage, the plaque and calculus enters into the gums, it causes gum infection, gum bleeding. Disease is called gingivitis. For this, usually we do deep curettage or laser curettage, whatever you call it. The cost of this varies from 15,000 to 25,000 usually. The next stage of gum disease, the final stage of gum disease usually is the gum disease spreads into the surrounding bone of the tooth. At this stage, we need to do a flap surgery combined with bone grafts or membranes. All this will cost around somewhere around 40, 50,000, even 60,000 it could cost, because the disease is called periodontitis and it involves all the teeth and bone. So you have to replace the bone, give bone, artificial bone and all these things. Both these gum diseases can be prevented by yourself. You don't need to come to a dentist. 90% of the diseases are usually preventable by proper brushing at home. So proper brush, toothpaste and floss, it hardly costs 200 to 300 per month for you. So the cost of dentistry is not very expensive. Your negligence, as you neglect the treatment, you come late to the dentist. This is the reason for the increased cost of dental treatments. So suppose toothpaste, which toothpaste to use? Most people ask us what toothpaste to use. There are thousands of toothpaste in the market. Actually, all these toothpaste can be divided into 3-4 types. I'll tell you which you can use whatever you want to use. So first is kids toothpaste. Kids toothpaste is usually you have below 2 years, 3 to 5 years and above 6 years based on their fluoride content. Then you have commercial toothpaste. Commercial toothpaste is toothpaste with salt, whitening toothpaste, freshening toothpaste, and you have toothpaste with the charcoal. All these types of toothpaste are little abrasive. They try to abrade your teeth if you don't use them properly, if your brushing is not gentle. So these toothpastes are good to remove the outer stains of the tooth. But be careful when you use this toothpaste. Then you have Ayurvedic toothpaste. Ayurvedic toothpaste, medicated Ayurvedic, herbal, natural, all these are like any other toothpaste. 90% of their combination is like any other toothpaste, but they have 5 to 10% of herbal ingredients. Then you have medicated toothpaste. Most of the medicated toothpaste usually have 5% potassium nitrate in them. This 5% potassium nitrate has been recommended by dentists around the world for relieving tooth sensitivity which is caused by wearing away of teeth. Then you have the fifth type, a new variety of toothpaste. This is Sensora toothpaste. This toothpaste, the speciality is, this is an Ayurvedic toothpaste with potassium nitrate in it. So it has the advantages of both Ayurvedic toothpaste and medicated toothpaste. It's like the best of both worlds. See, it has Ayurvedic ingredients like clove, cinnamon, camphor, all these things. They relieve teeth pain temporarily, then they relieve bad breath, bleeding gums, and the potassium nitrate relieves sensitivity. So you have to understand one important thing you have to understand in all these toothpaste. These toothpaste only give temporary relief to your problem. When there is a dental problem, only a dentist can treat the problem. Then toothbrush. There are 4 types of toothbrush. One is hard. Don't use a hard toothbrush. It will wear your teeth away. Brushing by hard toothpaste doesn't make your teeth cleaner. Then you have medium toothbrush. Medium toothbrush can be used if your brushing technique is gentle and soft, and in the right technique you are using, you can use a medium toothbrush. Then you have soft toothbrush. Soft is the best toothbrush. Everybody can use this toothbrush. It cleans the teeth properly. It won't wear your teeth away. Then you have ultra soft toothbrush or super soft toothbrush. These toothbrushes usually we recommend to patients after a dental surgery or flap surgery or gum treatment. Usually we recommend it to the patient for temporary use so that we don't harm the gums around them. Then toothbrush should not be put in your washroom or bathroom, because when you flush your commode, the water droplets will try to stay on the toothbrush. So keep your toothbrush out of your washroom. Then don't keep all your family members' toothbrushes in the same container so that the infection from one another can be spread to each other. Changing of toothbrush should usually be done after 3 to 4 months. Or if you get a cold, cough, fever, change your toothbrush, because the virus or bacteria will be staying on the toothbrush for a longer time. So better change it after you get well. Then toothbrushes, you see commonly people keep adding a cap on a toothbrush, which is not good, because when you try to put a cap on the toothbrush will be wet inside, and a moist environment attracts all types of bacteria and virus onto it. So it is not good to put a cap on the toothbrush. Let it dry. Gargle your mouth after whatever food you take. Either it is coffee, tea, food, whatever you take, good food, bad food. Gargle your mouth once, because water balances the pH of your mouth and brings it back to neutral. That is the best way to keep your teeth good.